Welcome to our live Q&A session. I'm Tyrell, and I'm here with Dr. Goldberg.
So my name is Jackson Goldberg. I'm one of the surgeons here. Here at Middleman Eye, we have a team of really great doctors. We have primary eye care physicians and surgeons, and we're here to meet all of your needs and talk about healthy aging. So a little bit of background on me. I did my undergrad at the University of Texas, so I'm a Texan at heart. I then went to medical school in Houston. I trained at the largest medical center in the world, the Texas Medical Center, home to MD Anderson and a bunch of other fantastic hospitals. I then went to Dallas and trained, did my ophthalmology residency at UT Southwestern, where I spent many long nights in the emergency rooms. It is the largest emergency room center in the country by visits every year. So many long sleepless nights taking care of very sick eyes. I went to Colorado for a little bit and practiced there, and then I moved to Florida. And I make my home here now in South Florida. My wife grew up in this area, and we have a young child, so that brought us a little bit closer to home. So it's great to be here. It's great to be taking care of such a fantastic population of people.
Yes, for sure. We have the opportunity to collect a lot of questions as it relates to healthy aging. With healthy aging, there are a lot of things to consider, right?
Right.
And some eye conditions that are directly associated with us getting older.
Birthdays give a lot of gifts. Yeah, some of them are not so good.
Yes. All right, so let's start with cataracts. Is that okay?
Yeah.
What is a cataract?
So cataract is a clouding of the natural lens that you're born with. And it happens to everybody if you live long enough. So if you live long enough, everybody needs cataract surgery. And what cataract surgery is it's basically a lens replacement. You're exchanging the old lens that's become a little bit dirty and not so clear, and replacing it with a brand new man-made lens.
Is cataract a condition that is age-related only?
So the vast majority of cataracts that I see here in clinic are age-related. Yes, there are other forms of cataracts. You have congenital cataracts. I always tell people I've done cataract surgery on people as young as 6 weeks old and as old as 102. So there are other forms of cataracts there, but the vast majority are age-related. And certain things speed up the formation of cataracts, okay? Things like diabetes, things like smoking are, modifiable risk factors that you can do to kind of help slow things down. The average age of cataract surgery in the U.S. is about 72. So,
wow.
As you start to have more and more birthdays and you start to notice that your vision is being impacted, cataracts are one of the most common reasons why that may happen.
Does the sun play any role in the development of cataracts?
Absolutely. UV light can increase the rate of formation of cataracts. So, it's important to wear your sunglasses and for a variety of eye conditions.
Is it okay to remove cataracts that are not fully mature?
So we take cataracts out when they start to become a problem, okay? I don't treat patients based on age, based on, just solely an exam. We look at when the cataracts are bothering you. So we call it when people have issues with activities of daily living. That's reading, that's watching TV. For down here in South Florida, for a lot of us, that's playing golf, that's driving, that's, all sorts of different things. So I always tell people, when it starts to affect the activities that you do, that you use your eyes for, then that's time to get the cataracts out.
There are a lot of misconceptions about cataracts. So you mentioned surgery, and we got a question that asks, can you cure cataracts with drops?
Not right now.
Okay, not right now, okay.
I have no idea what the future brings, but currently there's no drops, there's no pills, there's no glasses, there's nothing that can cure cataracts other than cataract surgery. Like I said, it's a clouding of the lens, and the only way to fix it is to replace that lens with an implant.
Now, after you get the surgery to replace the lens, can they ever come back?
Cataracts do not come back. It's a one and done. Sometimes you can get scar tissue that grows behind the new lens that we put in. That's very easy to take care of. We do it in clinic. It takes 30 seconds to do. We do it with a laser. It's a painless procedure, and your vision's cleared up, about an hour after we do that.
Why do people get cataracts? We talked about some of the risk factors, like not wearing sunglasses. But is it something that everyone should expect?
Yeah, if you plan on living long enough, everybody's going to get cataracts, especially living in a sun-soaked area like South Florida. Not to get into the weeds of it too much, but cataracts form when the metabolic rate of the lens starts to change a little bit, okay? So as we have more and more birthdays and our cells kind of start doing things a little bit more slowly and we're moving around a little bit more slowly, so too are the cells that make up our lens. They start to change, and as those changes occur, those lens cells get more and more opacified until it's like you're looking through a dirty window.
Some people have different experiences after cataract surgery. One person asked, why is their vision worse after cataract surgery?
That's atypical for sure.
Okay.
And it could be a variety of reasons. That person would need to come in for an eye exam and see one of our expert surgeons to kind of determine what happened and why that may be and how we can fix that.
Another common eye condition associated with older age is glaucoma. Can you define what that is?
Yeah, so glaucoma is usually high pressure inside the eye that causes damage to the optic nerve. And the optic nerve is the power cable that connects the eye and the brain. So just like it's pretty hard to watch TV if the power cable's not plugged in, it's pretty hard to see if your optic nerve is damaged. So glaucoma usually affects your peripheral vision, and a lot of times you don't know that you have glaucoma until it's very, very late. So it's important to get screened for these things so that we can catch them early and intervene before you have any sort of long-term damage.
Now, a lot of people, they'll ask, especially with technology, is there an app for that? Is there a drop for that?
There are many, many treatments for glaucoma. There's drops, there's lasers, there's surgeries. 2024 is not a bad time to have glaucoma. We have so many new technologies. There's new things coming out all the time. And of course, being the type of practice that we are always on the cutting edge of technology, always using the latest and greatest things in order to help treat our patients and help them see their very best.
Now, before I ask this question, there's another condition called AMD. What does AMD stand for, and what is it?
So AMD is age-related macular degeneration. And so, we can break it down just by the words. So age-related happens as you have more birthdays. Macular degeneration, so the macula is a part of your eye that's responsible for your crisp, clear HD 20/20 vision. And degeneration just means, something that gets worse with time. So basically you get these little calcified deposits that build up in your macula, which is a part of your retina, that start to make your vision a little bit worse. It comes in two different flavors, okay? There's a dry kind and a wet kind. And depending on what kind you have, the treatments may vary for them.
Okay, so with glaucoma, how does a person's vision change?
So with glaucoma, you tend to lose your peripheral vision
Okay.
until at the very end, late stage disease, it's like you're seeing through two tiny little straws. With macular degeneration, for example, that's a little bit different. You start to lose your central vision with that.
Okay. Are there cases where people develop both?
Yeah, definitely. So the conditions aren't necessarily related. So you can have one, you can have both, you can have, just because you have one doesn't necessarily put you at higher risk for the other. So it's important to, get a comprehensive exam in order to be screened for these sorts of things, especially as we have, as we get a little bit older.
So if that's the case, if someone has AMD and glaucoma, is it potential for them to go blind because they lose their central and peripheral vision?
So both diseases can cause blindness, and I always tell people that these things can cause blindness only if they're untreated, okay?
Okay.
And if somebody's sitting in my chair across from me, I always tell them, well, now that you know me, this isn't going to happen because we're going to get to know each other. You're going to come in, you're going to have your visits, whether they're annual, whether they're semi-annual, to make sure that, things are on the right track. And if you have one of these things, that they're being managed and treated appropriately and monitored appropriately to make sure that you have a life with fantastic vision, no matter, for the rest of your life.
Now, this is very interesting. Is there an AMD vitamin?
There is. So.
Oh, okay. Okay.
So, AREDS 2 is what the vitamin's called.
Okay.
There's a lot of different names for it. It's used to treat the dry form of macular degeneration. It kind of helps it helps prevent it from progressing. It's a fantastic medicine. And I recommend it for all of my patients who have macular degeneration. And a lot of people say, well, it's just a vitamin and it could help my eyes. Should I just take it anyway? And there's really no data to support that. That being said, they are just vitamins. The only thing it's going to do is hurt your wallet. So,
Oh, wow, okay.
But there's no good data recommending that.
And so the vitamin for AMD is called AREDS.
AREDS 2, yep.
Okay. You hear of people taking vitamins for conditions that they don't have. Like people taking prenatal vitamins,
Yeah.
vitamins related to things that has nothing to do with
Flintstones vitamins in my case.
Right. Okay. So is it useful to take AREDS too?
Yeah, so
if you don't?
that's kind of what we were talking about. There's no data that really suggests that it helps prevent the development of macular degeneration, but if you're eating leafy green vegetables and a nice round wholesome diet, you're getting all of those things anyway. So there's really no need to supplement with them. It doesn't help prevent the development of it.
So another condition that has come up a lot in our questions is presbyopia. Presbyopia.
Yep.
Am I saying that right?
You are.
Okay, perfect. What is that?
Presbyopia is the bane of every 40-year-old's existence, basically.
Okay.
So presbyopia is when your lens loses the ability to change shape and allow you to see up close. So you guys may see I'm on the younger side over here, so I can see distance clear, I can see intermediate clear, and I can see near clear.
Okay.
But let's say you go out to dinner in Palm Beach County and the menus come out, and what does everybody immediately do? They look in their bag or their pocket or around their neck and they put on their reading glasses.
Right.
That's because as you have more birthdays, you start to lose that ability to see up close. Okay, presbyopia is treatable. Okay, with a variety of refractive procedures, including a refractive lens exchange, which can allow you to kind of regain some of that depth of vision that we lose as we get in our 40s.
You have two conditions. You have presbyopia and you have astigmatism. Are the two mutually exclusive? Can you have both?
You absolutely can have both.
Okay.
So I'm going to grab my model here. So we just defined presbyopia, so now we'll define astigmatism. So astigmatism is when instead of your eye being nice and shaped round like a basketball, it's kind of smushed a little bit like a football, okay? So it's just a change in the shape of your eye that, causes refractive error, makes you dependent on glasses.
Is this curable?
Astigmatism is curable and treatable. It's treatable with refractive surgery,
Okay.
Which we do at the time of cataract surgery.
Okay.
Or it's fixable with glasses or contact lenses.
What about presbyopia?
Presbyopia also treatable
Okay.
with glasses, contact lenses, and refractive lens exchange.
Okay.
Or advanced technology lenses, which we use every day here at Middleman Eye.
Nice. Okay. So let's move on to floaters, which is funny because I learned about floaters just by working here. What are floaters? I'm sure a lot of people experience them and they just can't put a name on it.
Yeah, I mean, basically everybody has some degree of floaters, and they only get worse with age. So floaters we have gel in the back of our eye, and that gel really doesn't serve a purpose after we're developed when we're little babies. Okay. So as that gel degenerates a little bit, some of the proteins dissolve out of that gel. And when the light hits those dissolved proteins just right, it casts a shadow on the retina, and boom, a floater is born.
When someone experiences large floaters, is that a cause for concern?
It certainly can be. So any new increase of floaters, especially if they're associated with flashes or it feels like someone's pulling a curtain down over your vision a little bit, is cause for any sort of retinal pathology. Okay, so anybody with floaters and flashes, and especially new onset, needs a dilated eye exam.
Can floaters be removed?
They can be.
Okay.
Yeah, so floaters are treated with really two different ways. The first way is laser floater management, where we use a laser to kind of break those floaters up and, kind of get them out of the way of your central vision. And the other way is the floaters can be sucked out. When you can suck the gel out of the back of the eye, the floaters come with it.
Someone asked, why are some floaters gray and some white? Are those two different things?
So people experience floaters in a very different way. It kind of depends on your brain and how you process them.
Okay.
Sometimes people go into great detail and they explain exactly what their floater looks like, and I look back there and I'm like, oh yeah, it does look like that. I can see exactly how you're describing it. And sometimes it looks a little bit different to me. It really all just depends on how a person's brain processes it and what they perceive the floater to be. They can be all sorts of different, colors and shapes for people.
What are the differences between flashes and floaters?
So flashes are like when you get, a little sparkle or fireflies or 4th of July going on in your peripheral vision. And floaters are just kind of like when people are, reaching for a gnat, they think there's something there that there's not, just a transient little black dot in your vision or a streak or something like that.
So today we talked about a lot of different conditions. The only thing you can do as you continue to live is get old, right?
It's better than the alternative. That's what I tell people.
It's better than the alternative, but with it comes a lot of possibilities of these conditions developing. Is there a way to prevent that? What is a message that you have for someone who does have those fears?
In 2024, we have a lot of options to treat a wide variety of ocular disease, whether that's dry eye associated with aging, whether that's presbyopia, whether that's cataracts, glaucoma, macular degeneration. There are sophisticated diagnostic tools. We have a fantastic team. There are advances in surgical technology and diagnostic technology. There are new things that are discovered every day. So you are in a much better position if you have these things now than you would have been 10, 20, 30 years ago.
Okay.
My grandfather had macular degeneration and went blind from it. And really all that was available for him was assist devices, basically big magnifying screens that he had all over his house. And in order for him to read and see, there weren't these fantastic medications that we have. We didn't have, diagnostic technology where we could catch these things on the earlier side and intervene earlier and preserve vision.
Wow. So a lot of promise in medical advances, and it's only going to get more advanced.
Absolutely, every day.
For someone at their 20-year age milestone, 30, 40, 50, is there an annual screening or test that they can do?
Yeah, yearly eye exams are always a good thing just to make sure that everything in the eye is in working order, that your eye is anatomically perfect, that you're seeing well, that your surface of your eye is healthy, and just, making sure that you're not starting to develop any of these conditions, starting to develop cataracts, starting to develop glaucoma, macular degeneration, things like that. And a lot of these things, with how far we've come in diagnostics, we will catch them before people start getting symptoms, which is what we want. We want to treat people before they have vision loss, before they have problems, right? We want to make sure that these things don't become problems that impact your vision in your day-to-day life. We want to catch them before that happens and solve your issues.
So come in and see a doctor.
Yeah,
okay.
Basically.
Thank you so much. This is such an important topic that will touch so many people and inform so many people, and also quell some fears. There is a place where you can go. Our practice, we treat a wide range of ocular issues and conditions, as well as just routine checkups that you recommend.
Yeah.
Drop down any questions that you may have, and we'll be sure to continue answering them and continue the conversation in the comments.